Hi, Mindful Fertility subscribers. It's Buffy Trupp. We're here at the Integrative Fertility Symposium in Vancouver, BC, and I have an honored guest, Dr. Mark Sklar. He is reproductive wellness. His practice is in San Diego.
Yeah.
He's a Chinese medical doctor. He's also reproductivewellness.com. If you're looking for products online, he sells a whole suite of mind, body, and Chinese medical products online. Great to see you and meet you here.
Yeah, thanks for having me. It's nice to meet you.
So Mark, tell us about Chinese medicine from your perspective. You know, a broad sweep of, if you're struggling to conceive, what are the benefits of Chinese medicine? When should people come to a Chinese medicine practice?
Well, Chinese medicine works like any medical model, any medical system. It just works a little bit different, right? We're not familiar with the terms or the theories behind it, but its approach and ability to help with general health, especially when we're talking about reproductive health and fertility, is tremendous. And one of its specialties and long-standing history of benefiting reproductive health is fertility and women's health. And so fundamentally at its core, acupuncture and Chinese medicine work in two main ways. They're going to work by regulating the nervous system, and they're going to regulate and improve blood circulation. And with that, we can really address and support hormone balance and regulation. We can increase more blood supply to the uterus and ovaries and reproductive organs. And so fundamentally, those are the two main ways that, acupuncture and Chinese medicine will benefit and assist fertility and reproductive health.
Wonderful. So you see women in your practice that are trying to conceive naturally, are also involved in assisted fertility. Yeah, tell us a little bit about when a woman would come to you, and when are you referring to, say, assisted reproduction, and are you working with REs and the assisted process?
Yeah, those are all great questions. I might ask you to repeat one or two of them.
Yeah.
But outside of that, so I think fundamentally, and it's not perfect for everybody, but you ideally want, as a couple or an individual, you really want to start being proactive about your reproductive health and your overall health care as soon as you can. It's not something that you want to decide that you want to get pregnant, come to realize whatever time period down the road that you need help, and now your time is working against you. So, in an ideal world, you would get married and know that whatever time frame down the road you want to start to have a family and grow your family and have children, then you would start to work backwards from that time and say, okay, well, let me give myself 6 months or 3 months or whatever it is proactively to start to support my body, my reproductive organs. And so ideally when a patient comes in, we want a little bit of time to support you and give you the tools, the knowledge to start to make the changes and not feel rushed and pressured by, the time factor, as I call it, to push you in a certain direction. So as much time as you're willing to give is something that, I think will benefit you tenfold moving forward. Outside of that, in terms of integration with fertility clinics or reproductive endocrinologists, we do that all the time in our practice. It's about 50% of our practice are women who are trying to conceive naturally, and the other 50% are trying with either insemination or IVF. And so we've seen over the years and the trend that any integrative approach is going to yield better results because they're focused on the science of putting a sperm and egg together, which is what they should be doing because that's what they do well. But we're going to be focused on you, your mind, your body, the full suite of areas that need to support you from top to bottom and inside and out to yield those results. So that blend, that integration is really ideal for a patient.
Great. So maybe a specific comment about psychological care. Do you have patients in your practice that you refer out to counseling support? Lots of patients are dealing with recurrent pregnancy loss, and just the process of trying to conceive over years can cause a lot of anxiety and depression. Do you treat that in-house with Chinese medicine? Do you refer out to counseling?
Yes, all of the above.
Yeah.
So, as a core principle in Chinese medicine is always treating the emotional side of things and the mind. And so we will always address that within the four walls of the practice, but we always refer out to it as well because we're not counselors and we don't set aside an hour's worth of time to sit with a patient and review it. We will sit down with them, but if they need more, then we will refer out to it. And it's a big part. If we can't get ourselves in a great place up here, it will affect down here, right? And so we need that, both sides of it. And there's nothing in life that I've seen that can be accomplished without having a sound mind and a good attitude, positive attitude, and an understanding that you can and will succeed in whatever it is you're trying to do. And fertility is no different than that. So blending those things together is really a perfect marriage.
So last question, we're at the Integrative Fertility Symposium, and kudos to Lauren Brown and his team here. Just a fantastic discussion.
Yeah.
Just take-homes from you. What are you learning here? What are you seeing? We talked about trends a little bit, so yeah.
Yeah, I come to a place like this not to learn anything magically new, but really to see what sort of trends are happening and maybe learn a new nugget here and there. And so one of my favorite ones was really just a lecture on micronutrients and just seeing the research on all the key nutrients that are useful for fertility and reproductive health, and the research supporting that, and seeing what we can do as an integrative approach with both the fertility clinics and the more natural-minded clinics to support that. So that was one of the key things that I really took home, is just focusing on some of those micronutrients that can really support patients and
vitamin D.
yield those results.
Yeah, vitamin D.
CoQ10, ionisitol, DHA, which not new per se, but actually none of these are probably new, but they are useful if used the right way, and that's really what the research was showing.
Yeah.
So.
Thank you so much, sir. Really just a pleasure to meet you and be here with you. Again, Mark Sklar, Chinese medical doctor. He's at reproductivewellness.com, and of course you're here at mindfulfertilityproject.com.